a reminder of the potentially debilitating impact of polio. Abdul Malik contracted the virus when he was 8 and today is accompanying health workers on their rounds, helping to bring home to parents here outside Kano in northern Nigeria the importance of having their children immunised.
There are so many things that I would love to do, but I can't. And that's why I encourage everyone to bring their child to be immunised, to prevent polio.
Nigeria is the only country in Africa where polio is endemic, and the north is the main source of infections within the country and the wider region. So far this year, 51 new cases have been recorded out of a global total of 328. Suspicion, ignorance and security concerns have all played their part in hampering efforts to stamp out the virus for good. 9 health workers were shot dead in this area in February as they administered the vaccine.
So many families don't see the essence of immunizing their children, and thanks to the level of education, our level of education is so low that we feel there is no need for immunizing the child.
Some influential Muslim leaders in Kano openly oppose polio vaccination, saying it's part of a conspiracy against Muslim children. Gaining the trust of leaders and individual families is seen as half the battle. Here in the rural area around Kano, UNICEF-trained community volunteers go house to house to make sure every child under 5 gets a dose of the oral vaccine, including newborns like this one. Each health worker is armed with a mobile phone that tracks their movements. Data is then recorded and mapped to make sure everyone has been covered. At a local clinic, a suspected new case arrives.
Since he started walking, one leg has been hurting. It's been like that from the start.
It'll be weeks before this boy gets a diagnosis. But in Nigeria, the push is paying off. There are half the number of cases so far this year compared to last. And tackling polio here is seen as key to the global effort to stamp out the virus once and for all.